Today's news media offer an overview of what's going on, but some subjects deserve a closer look. I'm Terry Bradshaw. Join me as we investigate current events and issues, bringing you closer to the topics that matter and the people that make them happen. This is Edition. When you or a loved one need immediate medical care, most people's first thought is to go to a hospital emergency room. Many people actually use the hospital ER as their primary care source since access hours for family physicians are limited. Even while many hospital emergency departments are closing, ER visits are on the increase by about 30% in the last decade. Stories of lengthy, painful waits in an overcrowded emergency room are plentiful and frightening. Patients are usually uncomfortable, often in pain, and surrounded by strangers who may have a communicable disease. The solution is independent, freestanding emergency rooms. And in Houston or San Antonio, Texas, they are open and ready to serve patients.
It's important for us to let the public know and let our patients know that Elite Care is different from the hospital-based environment. We were founded by physicians who practiced emergency medicine in hospital-based environments, and we understand that model and how it works and how we could improve upon it, and that's what Elite Care is.
When an emergency department is located far from those who need it, it can be more than an inconvenience. Usually, an emergency means that time is of the essence. Freestanding emergency departments tend to be situated in the heart of the community, close to residential neighborhoods in shopping districts with accessible free parking. And since their mission is focused on only one aspect of healthcare, waiting rooms are usually far less crowded. Patient care comes quickly and efficiently without hours of agonizing waiting.
Freestanding emergency departments offer the same type of care that you're used to getting in a hospital-based emergency department. We just do it in an environment that is more conducive to rapid health care. In fact, the entire turnaround experience is usually quicker than what it would take you to get through triage in a hospital-based emergency department.
Elite Care Emergency Centers are fully licensed facilities staffed with emergency department physicians and support staff 24/7, 365. The centers are designed to be patient-centered, low-stress environments where waiting times are kept to a minimum. Each center is equipped with a full complement of diagnostic radiology capabilities such as CT scan, X-ray, and ultrasound. They also have advanced treatment facilities for contingencies like cardiac life support, trauma, and critical care.
When a patient experiences a healthcare emergency, timing is critical. We build freestanding emergency departments in local communities and neighborhoods where patients are used to traveling. The freestanding emergency department model provides an alternative access to quality emergency care right there in their own neighborhood.
Wait times at freestanding emergency care centers are usually around 10 minutes, with the national average for hospital ERs being almost an hour. And in the event a patient presents with more complicated problems and needs to be admitted to a full-service hospital, transfer arrangements are in place to do so quickly.
I had a great experience at Elite Care. I knew I couldn't go sit in an emergency room for half a day for them to finally see me. So I went to Elite Care and they made me feel so comfortable and welcome. I signed a couple forms. Within 10 minutes, I was in the back with a wonderful physician, and 20 minutes later, I was on my way back to school.
Some consumers confuse freestanding emergency centers with urgent care clinics, and the differences are quite significant. Most urgent care centers are only open during business hours and lack much of the critical staff, equipment, and facilities that hospitals and emergency care centers have at their disposal.
The main difference between Elite Care Freestanding Emergency Center and an urgent care center is the scope of services we provide. We have a CAT scanner, we have imaging, we have laboratory, ultrasound, pharmacy, we have trained doctors and nurses in emergency medicine. We provide a scope of service much more like a hospital ER than an urgent care center. When every minute counts for you or a loved one, a hospital may not be the best place for you to go. More often, you'll receive care more quickly and efficiently at a freestanding emergency care center.